This is part 2 of our Dying and Bereavement lecture. So now we're going to talk about end-of-life issues. So the final scenario. This is a way for people to make decisions known about how they do and do not want their lives to end. And everyone needs to make some decisions about many issues. So these are the end-of-life issues. Issues pertaining to the management of the final phase of life, after death, disposition of the body and memorial services, and the distribution of assets. So they have to specify whether you want traditional care like hospitals and nursing homes or alternatives like hospice. You need advanced directives such as your power of attorney for your health care or for a living will. You may want to resolve personal relationships like mend a rift between a family member and yourself. You want to make it known how you feel about euthanasia and what happens to the body after you die and what type of memorial do you want. These issues are hard to think about and maybe harder to discuss with family members, but it's important that someone knows what you want. Having a will is very important. That way what you want is in writing and legally binding, making it harder for survivors to argue about the details. One of the hardest parts is dealing with the separation from loved ones. So a lot of people want to affirm love, resolve conflict, and provide some peace to the dying person. If these things aren't achieved, survivors may be left without a feeling of closure. Giving a person an opportunity to make these decisions and mend those relationships gives them a sense of control of their dying, which may ease anxiety and make the last days easier. And it is really important that you make your wishes known because family members tend to make mistakes. A lot of times family members don't think that the dying person wants what they actually want. So it's important that they're written down or that somebody you trust knows what you want. Okay, so hospice. Most people would like to stay at home among family and friends. When this is impossible, many think they have to go to a hospital or a nursing home. But hospice is an alternative approach that emphasizes pain management or palliative care and death with dignity. So this focuses on quality of life, not the quantity. Their goal is to make the person as peaceful and comfortable as possible, not just delay their inevitable death. So that term I threw out, palliative care. This is care that is focused on providing relief from pain and other symptoms of disease at any point during the disease process. Medical care is available, but the focus is on pain relief. The focus is just on making the person comfortable. Hospice services happen after the person and or physician believes no more treatment or cure is possible or may be desired. So how is hospice different from other care? Well, in a hospice, they tend to view the clients and the family as a unit versus just focusing on the client. They believe that clients should be kept free from pain and that emotional and social impoverishment must be minimal. So clients are encouraged to maintain as many competencies as they can. They're encouraged to have conflict resolution and fulfill as many realistic desires as they can, and that's assisted, like mending a rift with a family member. And clients are free to begin or end relationships as they see fit. Someone in hospice will never force a client to see someone they don't want to see. Interdisciplinary teams work together to alleviate pain and fear. Hospice care is becoming more popular and more prevalent, and a lot of insurances cover it now. But some people might be reluctant to do it just because it's so different than what we expect. So here's a quest for you. Find a local hospice or a palliative care facility. Look up their philosophies and practices. How do these compare to the more traditional options like hospital or nursing home? Do they match what we covered just now in class? Making intentions known. If you don't make your intentions known and legal, medical professionals may not be able to follow them. So some things you need to do are a living will. This isn't the will that determines how you want to distribute your assets after death. This is a document in which a person states his or her wishes about life support and other treatments. Do you want artificial life support? If you do, how long are you willing to stay on it? What do you want if you're in a persistent vegetative state? Things like that. You also may want to designate a healthcare power of attorney. This is another way to make intentions legal. There is a financial power of attorney and a medical power of attorney. These might be the same person or they might be different people. Who is going to make decisions for you when you cannot? You give that person your power of attorney. If you are unconscious or otherwise unable to make decisions, this person is legally allowed to make those decisions on your behalf. So you want to choose this person with care and make sure that that person knows what you want. So both of these, the living will and the power of attorney, make your wishes known if you cannot communicate them. Issues such as life support, organ donation, and others. Something else people might have is a DNR, a do not resuscitate order. This is a medical order that means that CPR is not started should one's heart and breathing stop. If you don't have a DNR, medical professionals must attempt life-saving techniques. If you don't have one, they have to try. So if you don't want them to try, you need to get a DNR. If you do have a DNR and they act against it, if they try to revive you, even with a DNR, then they could be sued for assault. It is therefore very important to make sure that everybody knows about it so that the medical professionals can act appropriately. For all of these, there might be a competency evaluation. So patients have rights. They have a right to make their own healthcare decision, to accept or refuse medical treatment, and to make advanced healthcare directives. However, they must be judged competent to make those decisions, which is a medical and legal determination. If someone is not judged competent, then someone else may make decisions for you, a family member or a judge. Research shows that family members and other decision makers are often wrong about what the patient really wants. That is why it's so important to put it in writing. The grieving process. So now let's talk about the survivors of someone who died. So some definitions here. Bereavement is the state or condition caused by loss through death. Grief is the sorrow, hurt, anger, guilt, confusion, and other feelings that arise after suffering a loss. So these are the emotional reactions to a loss. And then mourning is the ways in which people express their grief. Maybe they wear black, attend funerals, etc. Mourning is heavily influenced by culture. So grief happens in everybody, it's just your feelings. But mourning is a cultural thing. So there are different mourning rituals based on your culture. In some cultures, the deceased spouse's sibling will marry the widow. Okay, in some cultures they wear black and have a funeral, and some they wear white. Okay, every culture is very different in how they deal with this process of mourning. So the process of grief. There's no one right or wrong way to grieve. Okay, so don't ever let anyone tell you that you're not grieving the right way. There is no right way to grieve. Part of the grieving process is reorganizing your life and establishing new patterns. Grief involves coping choices and is an active process in which a person must acknowledge the reality of the loss, work through the emotional turmoil, adjust to an environment from which the deceased is absent, and loosen their ties to the deceased. Again, grieving is an active process. It's something you have to actively participate and work through. And grieving varies by individual. It takes time and it's different for each person, but research shows it takes at least a year to begin recovery from grief. We learn to live with loss rather than recover from it. So I saw a theoretical framework once that said, when you experience grief and it gets better over time, it's not that that grief has shrunk or healed in any way, it's that your life has grown around it. So the grief will always be there and you have to learn how to live with it. And this is a process, grief work. This is the psychological side of coming to terms with bereavement. People need time and space to grieve and do the work of recovery, and it is work. So some typical reactions. Feelings involved usually include sadness, denial, anger, loneliness, and guilt. But there are 5 common themes in the grief experience. So there's coping. This is what people do to deal with the loss. Their affect. This is the emotional reactions to the death of the loved one. Change, ways in which the survivors' lives change as a result of the loss. Narrative, this is the stories survivors tell about deceased loved ones. If you've ever noticed, people love to get around in groups and talk about the deceased in a way it makes them all feel closer. So that's the narrative. And the relationship, the ties between the deceased person and survivor. So all of these are themes that come up over and over again in the grief experience and that have to be dealt with. Physiological reactions such as sleep disturbances, neurological and circulatory problems are also common. Anniversary reaction. Dates that have significance may reintroduce the grief. Birthdays, anniversaries, holidays, etc. So some people just might feel more sad around holidays or a birthday or a wedding anniversary. This is especially true on the anniversary of the loss itself. Grief is long-lasting, and some people never truly get over a loss. It never fully goes away. And we'll talk about how people cope with grief in the next lecture.